Welcome to the Living Donor Liver Transplant video. This video will cover the living liver donation option and what to expect as a donor and recipient. For those on the waiting list, the wait to receive a liver from a deceased donor is long. Livers are often based on many factors, including a MELD score. MELD stands for Model for End-Stage Liver Disease, and it determines how sick you are and how urgently you need a transplant. Those with a low MELD score are not likely to be offered a liver in a timely fashion. An alternative to waiting on the list is a living donor liver transplant. A living donor liver transplant is a surgery where part of the donor's liver is removed. It is placed into someone whose liver is no longer working the right way. The donor's remaining liver regrows and returns to near its normal size, volume, and capacity within a couple of weeks after surgery. At the same time, the transplanted liver portion grows and restores normal liver function in the recipient. Now that you've learned about living donor liver transplantation, let's go over the process from surgery to recovery. It can take an hour or more to prepare a donor for surgery after they're under anesthesia in the operating room. The procedure removes about half of your liver. It takes between 4 to 6 hours. A cut is made below your rib cage. Your gallbladder is removed as a standard part of the procedure. When the part of the liver that will be transplanted is ready to be removed, it is flushed free of blood and cooled. Then it is taken into the operating room where the recipient is ready to be implanted. At the same time the recipient is getting their new liver, your surgery will be completed and you will be taken to the surgical intensive care unit. Throughout the procedure, staff will keep your family updated on how you're doing. Afterwards, the transplant team will head straight to the recipient's room to complete their surgery. The team will meet with you and your family as soon as both procedures are done, and the recipient is in the intensive care unit as well. Most living liver donors stay in the ICU for 1 to 2 days. While in the ICU, you will have many tubes and catheters in place. You may even wake up with a tube in your throat to help you breathe. That tube will be removed as soon as you're awake enough to breathe on your own. You will also be given pain medicine to stay comfortable. After the ICU, you will recover on the transplant unit. You will start eating food and the remaining tubes and drains will be removed. You will continue to receive pain medicine, but will switch to taking pills so you and your support team can get ready to go home. Before leaving, you will get post-surgery care instructions such as how to care for your incision. Your care team will check in on you often and be there to answer any questions. Removing part of your liver is a big operation that has risks. The donor surgeon will talk with you about all risks during the evaluation process. The short-term risks are mostly the risks from surgery and could be things like pain, bleeding from the surgery, pneumonia, blood clots in your legs that can move to your lungs, injury to surrounding tissues or other organs when the liver is taken out, infections in the wound or deeper near the liver, and risk from anesthesia, including heart problems. About 30% of patients have some type of complication. Other serious complications are directly related to the liver and include leakage of bile, liver failure, or a blood vessel problem. The most serious complication is death, which happens in about 1 in 500 to 1 in 1,000 cases. After surgery, if the procedure goes as planned, your time off from work or school depends on their physical demands. You will have a follow-up appointment in the clinic 1 to 2 weeks after the operation for a checkup and lab work, and then as often as needed based on any symptoms you might have. Your care team will follow you closely after your donation and see you back in the clinic to check your vitals and liver function. Transplant centers must report living donor follow-up data at 6, 12, and 24 months after donation. It's recommended that you have your blood pressure checked every 6 months for life and test your liver function once a year during your routine physical exam. You can be seen in person or through a telemedicine visit. There are some psychological effects of organ donation, such as being worried about what might happen to your donated liver in the recipient's body after transplantation, issues with body image due to scarring, and issues with health insurance in the future. Your care team will talk about all these potential concerns with you during the evaluation process. It can be hard to ask someone to donate part of their liver, and it can be hard to decide to donate. There are a lot of things to think about, more than what can be covered in this video, but thank you for considering this path. For questions or more information, please talk to your transplant nurse coordinator at the University of Iowa Healthcare Organ Transplant Center. You can also review any of these excellent resources listed here. Thank you for watching.